In 2020, we said never again. But right now, in 2025, the World Health Organization is tracking 8 deadly pathogens. 3 of them have fatality rates over 50%. The next global health crisis isn't a question of if, it's when. And that when might be sooner than you think. In the next 5 minutes, I'll show you what experts are warning about and how to protect yourself. Let's talk about what's happening right now that most people are missing. First, the COVID-19 pandemic reversed an entire decade of global health gains. That's unprecedented in modern history. The CDC is expecting COVID-19 hospitalization rates for 2025 to 2026 to be similar or higher than the previous season. We're not out of the woods yet. But here's what's really concerning. The WHO has identified several high-risk pathogens, multiple influenza strains that are mutating rapidly. Marburg virus, with a fatality rate up to 88%. Mpox, which we've already seen spread globally. Nipah virus, another high mortality threat. And yes, bird flu cases are being reported, though immediate risk is currently assessed as low. The real problem? Our global health infrastructure is more vulnerable than ever. Underfunded surveillance, uneven lab capacity, and fragile supply chains mean late detection and slow responses. That delay gives a virus time to seed new communities, and mutations multiply. And when misinformation spreads faster than the facts, even the best interventions can fail. How does a virus actually jump from animals to people? Step 1. An animal that's actively shedding virus. Think bats, birds, or livestock. Step 2. The virus needs the right molecular key to open our cells. Step 3. Inside, it replicates, mutates, and if lucky, spreads person to person. Some environments act like mixing bowls: markets, factory farms, and wildlife trade. In farms, different viruses can swap genes, creating new, unpredictable strains. Then modern travel turns a local event into a global problem, fast. That's why just one infected traveler with a new variant can change everything. Timing matters. Respiratory outbreaks love cool, dry seasons. Cold air weakens nasal defenses and lets virus-laden aerosols hang in the air. So what do experts watch? 4 big signals. 1. Unusual clusters of severe illness at clinics or hospitals. 2. Rapid case doubling across multiple regions. 3. Genetic sequencing shows new mutations that could dodge immunity. 4. Hospitals hitting surge capacity and supplies running low. When those signals align, governments and health systems must act fast, but they don't always. What needs investment? Surveillance, lab networks, stockpiles, and clear public communication. And what you can do today: keep vaccines up to date, build a small emergency stash, practice good hygiene, and trust expert guidance. The clock may be ticking, but preparedness shortens the countdown. As experts confirm sustained multi-country spread, that first Monday after those benchmarks is when the world shifts into emergency mode. We can't stop every virus, but we can stop many from becoming pandemics. Will you be ready? Vote in the pinned poll. What should governments fund first? Surveillance, vaccines, or health workers? Comment below.